If you're watching this video, it's very likely that you or somebody you care about has been affected by Bell's palsy. Bell's palsy is a distressing condition which is as a consequence of temporary facial paralysis, usually on one side of your face. And what happens is the facial nerve, where it passes through the skull, becomes inflamed, and as a consequence, the muscles and the areas of the face served by the facial nerve don't function properly, and the whole side of the face drops down, so your mouth may droop, your brow may droop, you may not be able to close your eye, and you might have problems eating. So it is quite a distressing condition, and it comes on really, really quickly. Recent medical evidence suggests that Bell's palsy may be caused by herpes simplex, which is the virus which causes cold sores. Chinese medicine has a completely different view of the health and the body, and in Chinese medical terminology, Bell's palsy is actually caused by the invasion of external wind cold into the body, and effectively that's getting a really bad cold in the side of your face. And it's really interesting that if you talk to emergency services drivers, ambulance drivers, police patrol car drivers, they're very, very vulnerable to getting Bell's palsy, and if you talk to them, they will say that their drivers get Bell's palsy from driving around at great speed with the window of their vehicle open. And that fits very much with our belief about how Bell's palsy is caused in Chinese medicine. So what can you do about it? In around 2/3 of people, the symptoms will spontaneously disappear of their own accord. But without any treatment, around 1/3 of people will suffer mild to moderate disfigurement after contracting this condition. So it is really important and really helpful to get treatment as soon as possible. Acupuncture has been shown to be at least as effective as steroids in treating Bell's palsy, and it's one of the kind of miracle situations that you see with acupuncture, that people really do respond really, really well to acupuncture. What is important though is you should try and get your treatment as soon as possible. And the people who start very quickly do tend to recover more quickly and more completely. If your case is severe, you'll likely need to come for acupuncture twice a week, probably for the first 2 to 3 weeks, then probably weekly for a couple of weeks after that. And where we go after that depends on your recovery, but I would expect that you would be largely recovered within 2 to 3 weeks. Some patients like to come, especially if they've been very run down, like to come for occasional acupuncture top-ups afterwards, just to help protect them from further attacks in the future. In terms of actually what happens during your treatment, yes, I will put a few needles in your face. They are absolutely tiny, these needles. Each needle that I use in your face is probably no wider than a human hair, and it may sound a little bit alarming, but actually most patients actually find there's virtually no discomfort at all, and to be honest, they're so relieved to be able to do something about this horrid condition that people tolerate it really well. So we use some facial points. We might use them in the brow, I might use them around the mouth, and what we're doing is we're stimulating the muscles and nerves in the face to recover. And sometimes people have a little bit of twitching after the treatment, which is good because it means it's starting to wake up the facial nerve. We'll also use during that treatment some body points, and they're really important to use. We'll use points here in the hands, and this is the command point of the face. We also use points in the feet, and very importantly, points on the lower legs. And the points on the lower legs are hugely important because we warm the needles on these points in a process called moxibustion, where we put little tiny caps of a herb called mugwort on the top of the needles, and we warm the needles. And it's this treatment that fundamentally helps to drive out the cold from the system, which is causing the Bell's palsy. And it's also a really nice treatment to have. We're also using points to help build blood and build energy to kind of build you up and help your immune system. So what's the acupuncture actually doing? It's reducing inflammation, it's increasing the circulation of blood to the face, and it's helping to build up your immune system. Because at the end of the day, acupuncture doesn't fix you, it helps your body to help itself. If you've been affected by Bell's palsy, It's probably because you were under stress to begin with. Maybe you've been overworking or run down for some reason. So a very important part of your recovery is to look after yourself. You need to nourish yourself. You need to get plenty of rest. I would strongly recommend that you take time off work, although the doctors wouldn't necessarily agree with that, but you need to rest and keep warm and look after yourself. It's also a very good idea to take some supplements. Good multivitamin is a really good idea. Take some omega-3 and some turmeric to help reduce inflammation. It's also recommended that you top up with additional vitamin B12 and zinc. And these are vitamins and minerals that are particularly important for nerve repair. So that's something that you can do that will really help you. We're very lucky because there's a really good facial palsy specialist clinic at the Queen Victoria Hospital in East Grinstead, and the physiotherapists there will help you. They will monitor and measure the degree of the droop of your face so you can see how you're progressing, and they will also give you exercises and self-massage advice, which will also really help, so you can help to stimulate the muscles yourself. So you can ask your doctor for an urgent referral and get to see them as soon as you can. Over the years, I've treated lots of people for Bell's palsy, and the vast majority of people with acupuncture make a really, really good recovery. So acupuncture can really help, and I would absolutely recommend it. If you want to hear some people's stories of other people who've suffered from Bell's palsy, there are a number of reviews from patients about Bell's palsy on my website. So take a look. And if you have any more questions about any aspect of Bell's palsy or acupuncture, please do not hesitate to give me a call. Thank you.